recession. But the cool thing about dentistry is when dentistry is done right, it is largely recession-proof. Largely recession-proof. Think about it for a minute. Necessary dentistry. And a lot of the treatment that's done in every practice in the country has to do with everyday, necessary dentistry. And if people are experiencing pain or discomfort or concerns, they need that care whether the times are good or bad.
Yes.
And so dentistry is largely recession-proof, which I want to make a statement as I go into these lessons. I want to make a statement that I think the best practice model, there's many different practice models, but I think the most resilient practice model is a practice that has a really solid general dental foundation, a foundation doing general dentistry, everyday general dentistry. Think of that as the bread and butter.
Right.
And then that practice also has a part of their practice that has to do with what I like to call high-value services. The more elective, comprehensive things. Things like placing and restoring implants, adult orthodontics, cosmetic dentistry, maybe complex restorative dentistry, helping people with full mouth, more complex restorative dentistry. Maybe things like oral conscious sedation. Maybe it's diagnosing and treating sleep apnea with appliance therapy. I like to think of that as, we call those high-value services in our vernacular. And I like to think of that, using our analogy, as bread and butter is everyday general dentistry. But the high-value services are the proverbial frosting on the cake. And you can increase or decrease the high-value services, at will. When things are good and money's flowing, there's more interest in the high-value services. But that gives you a practice foundation that is solid, as opposed to a very niche-oriented practice. And if the practice is very niche-oriented, you could run afoul in declining economic times. In fact, all we have to do is go back, to the last recession, the Great Recession, and there were many practices that had gotten very niche-y. In fact, the entire practice was built around cosmetic dentistry or built around dental implants. And they discovered that particular focus wasn't especially resilient when the time went down. Now, that's not to say that you can't do high-value services. I'm going to talk about that in a minute. You can absolutely do high-value services during those times, because not everybody is affected by the recession the same way. Yes. Some people actually economically thrive in a recession.
Right. Usually the people who are at the bottom end of the economy, they struggle, but pretty much people who are on the higher end, they thrive. At least that's what happened last.
The strong get stronger.
Yes.
And the weak get weaker. I mean, that really is accurate to say.